Welcome to day 2. Yesterday on day 1, we talked a lot about finding the motivation to commit to 14 days of consistent exercise. You've returned, so I'm proud of you. On day 2, we're going to do an exercise routine I call the chest opener, a great program for posture and for neck, shoulder, and upper back pain. So we're going to start lying down on our backs. So if you're not already there, if you're just waking up, hopefully you're there already, but let's get on our backs. You can use a pillow if you'd like. I'm going to go without to get a little bit more neck and upper back extension as I lay flat on my back. Just going to toss that down here. Adjust your body position because we're going to be doing some shoulder movements overhead to start. So if you have a headboard, you may want to scoot down towards the foot portion of the bed or change your angulation on your bed to create that motion. Do what's comfortable for you. And we're going to start with both knees bent. So if they're not already, just slide the heels towards your butt to get into what we call a hook line position. Nice, comfortable, nice and supported. We're going to begin with the arms down to our sides. Palms down is fine to start. Gently tuck the chin into the front of the neck just to lengthen the back of the neck. We just don't want that chin kicked way up. So nice and lengthened spine posture. A lot of us get a forward head position over time, working on the computer, on our phones, our day-to-day tasks. So that's nice thought to stretch that out. And from here now, we're going to work just 3 nice breaths, taking that practice from yesterday and integrating it into this day's practice as well. So close your eyes if you want to, or just kind of soften the gaze a little bit. Nice breath in. Remember, the belly should push upward to the ceiling, and on the exhale, recoils back in toward the spine, engages the abdominals. Nice breath in again. Slow and controlled, and exhale. And one more time, deep breath in and out. Now if your eyes were closed, just kind of open the eyes, roll the palms up facing the ceiling, and we're going to keep the elbows nice and straight, body relaxed, weight of the body just resting into the bed or the mattress. And now from here, with the fingers spread wide, we're going to bring both arms out to the side as if we're making half of a snow angel. Fight that urge to want to lift the arms up to the ceiling here. That's a compensation when the shoulders and the upper back are stiff. Get a nice stretch. Again, if you have a headboard and you hit that, just take it to that point. If you can come over top, you can elevate slightly if you'd like, or scoot your butt down to give you more room. But just take it to where you feel a nice stretch, and exhale to bring the arms down. Take a deep breath in again, arms up. And on the exhale, both arms come down back towards your hips. And this time, if you want to engage or create a little fire in your abdominals, bring both knees up and draw that belly kind of down and in. Neutralizes your lower back. Deep breath in as you bring the arms up. Helps to keep your lower back nice and flat to isolate the thoracic spine or that upper back area. And exhale. If you can't get there, that's fine. Don't worry. We'll always progress into these postures. Just do what you can for today. But this is going to take us to the next position. We're going to keep the knees up toward the chest here, about a 90-degree angle at the hip. Bring the arms up to a T position. It's about a 90-degree angle at the armpits. And if this is too much on your lower back, or it's too much on your hips, or you're just not strong enough to hold it there yet, you can always keep the feet down and we can create motion from here. That's perfectly fine. But if possible, let's bring those knees up again. And we're going to try to bring the knees together or close together. If you can't and you want to put a pillow between here, that's always fine as well. And from here, we're going to keep the palms up, arms relaxed into the bed, and let both knees roll or fall toward the right side. Starting out, just keep the neck nice and neutral, looking straight up. Again, fighting the urge to want to let your chin kind of kick up to the ceiling, create that extension. We want to get a nice retracted or lengthened position in the spine. Left shoulder blade stays flat. And then bring the knees back to center. You can pause for a second or transition directly, knees to the left side, keeping that right shoulder nice and flat. Obviously be careful in terms of the width of your bed. This bed is not that wide. I don't want anybody to fall on the floor. That's not a good look for anybody. Safety is always priority. And then bring the knees back to the center. Let's go one more time, knees toward the right, and this time take a nice breath in and turn the head like you're looking over to your left hand. Give it a little wave, say hello, identify with your extremities. Sometimes we kind of just get in the routine of things through the day. Knees back to center, and then knees toward the left, turn the neck to the right. Helps to also facilitate keeping that right shoulder down, or that shoulder that we're turning the head toward, to add stretch. Again, if your knees are starting to separate like mine here, I'm a little stiff this morning, just keep that nice stretch position. Try to draw the knees together. And then knees back up to the center of the midline. Drop the feet down, and then just slide the arms down to your side. Now from here, we're going to come to a sideline position and come to a seated position from there. So you can pop straight up, but especially if we're just kind of getting moving, and the goal of this is subtle, gentle movement, roll onto your side. I'm going to roll on my left side, and then come to a seated posture from there. It's just easier on your back, on your spine. And now from here, we're going to bring the feet flat to the floor, or at least close to it. If you need to use a little bit of a box, or you have a bed frame and you want to put your feet on the bed frame there as well, that's perfectly fine for this. I'm going to come down, feet flat. We'll grab my pillow and just pull it back up here. And from here, create that nice tall sitting posture like we worked on yesterday. We're going to bring the elbows tucked into the side of the body, palms rotated upward. So it's just a forearm rotation to get the palms up. Spread the fingers wide, and again, just be mindful to bring that chin kind of in line with the shoulders, or tucked in slightly so we're not creating a forward head. From here now, we're going to do a wing arm breathing exercise. So a nice breath in as we rotate the arms away, but elbows stay tucked to the side, gentle squeeze in the shoulder blades, and exhale. Hands come together. Deep breath in again. Ribs expand. And on the exhale, hands together. Nice breath in one more time. Think of tucking those shoulder blades down and back. Minimize the shrug, but open the chest, open the shoulders. Pull the thumbs behind the body, and exhale. Really nice for the rotator cuff as well. That's a primary function of that muscle group. Now from here, we're going to take both palms and place them almost on the lower back, kind of the lateral or outside portion of your pelvis, the top of your rear end. Thumbs facing forward. And from here, most of us, our elbows will kind of just naturally fall to the side. As you sit up tall, create that movement from your pelvis. Gently pull the elbows back together. It's almost like a bird tucking their wings in. And you should feel a gentle stretch through the front of the shoulders, through your pecs, or that chest area. Exhale just to relax the arms. Perfect. One more time. Press the palms into the top of the pelvis or lower back and tuck those elbows in together. Squeeze the shoulders back. Pull the head and neck back in line with the body. And the hands kind of give that nice support to keep you upright and lifted. Exhale to release. Let's do one more. Feels really nice. Gently push up to sit tall. Squeeze the elbows together. Nice breath in. And exhale out. And now from here, we're going to take the arms and just bring them in front. Just kind of shake them out a little bit if that was a little strenuous for the shoulders and the chest. We're going to take the arms behind the body if you can get there. And we're going to interlock the fingers just like this, right behind your back. And from this position, gently push the knuckles down into the mattress and start to take the arms away to straighten your elbows. And gently sit up nice and tall. Your hands can stay on the mattress to give you some support. If you're flexible enough, I am not, you can start to take your knuckles away from the mattress. That's a little bit difficult for me, but I want to encourage you to take your body to those extremes if you can get there. And then just kind of relax. Bring the knuckles or the hands back in toward the butt. Let's go one more time, sitting up nice and tall. Push the hands down to help lift you there, and gently slide the arms back, keeping the elbows straight if you can. And relax. And now we're going to do one more progression from there. If you want to relax the arms a minute, sometimes it's even nice to then change the interlock position. So let's go opposite side interlocked. And from here, we're going to gently push down slightly to lift our body upward a little, slightly to the ceiling. Bring the arms behind, just slide them back on the mattress to lightly straighten the elbows. And now, feet planted firmly, let your body tilt forward into a flexed position and your hands come up away from the mattress. Head drops down, and if you can, reach up toward the ceiling. Take it where you can. This is a hard stretch position to get to for a lot of folks. And then breathing out, come back up. And you can see how some of these movements build on each other. This is very similar to yesterday in terms of some of these spine movements. Now we're adding the shoulder motion with it. One more time, reaching away and tilt forward as you reach up to the ceiling with the hands. Exhale to come back up, and then just loosely relaxing the arms from here. Now we're going to take both palms and place them on the edge of the bed right next to your legs. Bring the feet in slightly. You can have them touch if you want. I like to keep about 3 or 4 inches between. From here, scoot your butt forward. Palms stay nice and flat. Fingers can curve over the edge of the bed here for comfort onto the wrist and fingers. And see if you can get your butt or pelvis to come off the bed. If you feel a stretch here, perfect. Think of pressing the palms down to lift yourself up and away. It kind of prevents that sagged, shrugged position through the arms. So press up and away to lengthen the spine. And if you feel the stretch, great. If you don't, walk the feet forward one at a time into this kind of reverse tabletop position. I want you to gently push the pelvis or the front of the pelvis, that belt buckle area, up toward the ceiling, squeezing the butt. Really nice stretch through the shoulders. Let the neck just kind of relax. And then breathing out. Sink back in. Good. If you want to take a seat and come back on, that's fine. If not, hold that position. Nice kind of strengthening pose through the triceps and through the back of the shoulders, those scapular depressors. Now from here, same thing, pushing the palms down, lengthen the spine, push the feet into the floor to squeeze the rear end and press your pelvis up to the ceiling to stretch through the shoulders, the arms, and exhale. And let's go butt back to the bed, feet to the floor. And now we're going to transition into what we call a robbery or a hold-up position. But now we're getting, again, up out of bed, get ourselves upright. So from here, we're going to start with the hands on the thighs, similar to yesterday's practice. And as we stand up, we're going to simultaneously bring the arms into a W position. And this is our hold-up posture. So gently hip hinging forward, push the feet into the floor all the way up to standing. And then palms forward, squeeze the shoulders back. Reduce the shrug. We don't want to be here. Let the shoulders drop down and pull those elbows back. And then bring the elbows together as you sit back down to stretch the shoulder blade area or the middle back. And then as you stand again, separate the elbows, pull them behind the body. This nice W posture. Breathing out to take a seat. Forearms and elbows together. Let's do one more time. Standing up. Separate the elbows, pull the arms back, keeping the elbows bent. And grabbing a seat. And relax the arms. Wonderful job. Day 2 completed. I'll see you tomorrow on day 3.